Hi, I'm Deborah Sims. I'm a CLL patient from Melbourne in Australia, reporting here from ASH on behalf of the Lymphoma Coalition, and I'm very privileged to be joined by Dr. Max Topp. You did an amazing presentation yesterday on CAR-T. It's an incredibly exciting field for us as lymphoma patients who may need CAR-T in the future. Tell us about what you presented.
Well, I presented an update of the phase 2 trial where we asked a question if we can add a certain new mitigation strategy, can we improve the risk-benefit profile for our patients? I mean, the down the road we already have now a therapy that a 3 years follow-up period, we have 47% of the patients still alive, with the vast majority of them still being also in leukemia and lymphoma free. So the question is, can we improve on this by actually giving this therapy in a more favorable way? We developed a new scheme of giving steroids very early onwards to dampen cytokine release syndrome, which is one of the major toxicities, and also neurotoxicity, which is the second and most probably for the patients the most compelling toxicity. And we then ran this phase 2 trial extension of the phase other trial, and we could demonstrate that by using just low doses of steroids that the toxicity profile, particularly neurotoxicity profile, could be lowered by more than 70% of severe neurotoxicity without actually compromising the effectiveness of the therapy. So this is just an advance for the patients in the future to give this therapy even better without impeding the profile of efficacy.
Because that is what's so scary for patients who are preparing for CAR-T, is the fear of cytokine release syndrome.
Yes.
And I think we're seeing a lot here about the ways that you've been mitigating this. And your presentation was on steroids, but there's been some new compounds that are also being added in.
Yes. Well, there's been, in that particular session, there was another update of another clinical trial where they actually have a new way of making the product. And the data that was presented by the US colleague from Boston showed that actually only about 5% of the patients actually developed a severe cytokine release syndrome. So that is another step forward in the right direction, and it most probably will lead to that we will define patients who are low risk based on some lab findings that we can do this most probably as an outpatient. Whereas there might be some patients where we feel this could be a high-risk patient, we most probably will hospitalize that patient and be just very happy to do that, of course, for that. So that will be the next steps that we are seeing here.
Well, thank you for all you're doing. It's a very exciting field, and enjoy the rest of ASH.
Thank you very much.